And welcome back. The Albert Einstein College of Medicine and Montefiore Health System has recently received a $30 million grant. Now, the Science Award will ensure that the Institute for Clinical and Translational Research will further its vision to improve health in the Bronx, as well as Westchester and Lower Hudson Valley. We've got sharing with us now the co-principal investigator of the CTSA grant. She's also the Associate Director of the Institute for Clinical and Translational Research at the Albert Einstein College of Medicine, Mimi Kim. And thank you so much for joining us.
Thank you so much, Sharon, for having me and for your interest in our work. We're really excited about the work that this new grant is going to support.
Yeah, I mean, $30 million is coming your way. And talk to us about how this grant is going to be played out in the community.
So let me give you a little bit of background first about our institute. Our Institute for Clinical and Translational Research was established in 2008. And our vision has always been to improve the health of people in the Bronx and other communities by speeding up how scientific advances lead to new drugs and other ways to treat and prevent disease. And the purpose of the Institute is really to catalyze research and provide resources that investigators need to move research more quickly and efficiently from the lab to the clinic and into the community. Over the past 15 years, we've supported about 1,000 research projects each year, and many of these address diseases that are of particular concern to the Bronx community, such as diabetes, opioid use disorder, HIV, cardiovascular disease, cancer, and asthma.
Yeah. And so in this particular grant, what are we going to see happen, and where will this grant particularly focus?
Well, we have two main areas of focus in this grant. One is advancing translational science, and the other is advancing health equity. So let me first talk about translational science. I mentioned that we want to speed up the rate that scientific findings can be used by healthcare and research teams to improve the health of people in our communities. So translational science, it's a new field that focuses on studying and addressing barriers in doing research. In other words, it's the science of how to do research. Many researchers are often doing animal studies or very early work in cells, and that's called basic research, and it's foundational work. But then you have to translate those findings into other research, like clinical trials, which your viewers have heard about, that lead to new diagnostic, prevention, and treatment strategies. But doing this translational research is very expensive and often takes a really long time. I think many people would be surprised at how costly and extensive the behind the scenes work is for research. For example, it can take on average 10 to 15 years from time of early development of a drug to when it reaches the medicine cabinet. So our scientists need staffing, training, equipment, access to data, information that can help them in their own studies and ways to make recruiting patients more efficient and effective. So the funds from our new grant will help us to advance the field of translational science and improve what we call research infrastructure.
Yeah. I want to talk for a moment about health disparities because we find them very huge across New York City, even in Westchester County. And I think the COVID-19 pandemic has really helped to further exacerbate what already existed, the fact that there were these health disparities. But I know that a part of this grant is really going to speak to dealing with that and addressing that.
Absolutely. So we're going to do a number of things to help address health disparities. First, Einstein and Montefiore has always been committed to equitable access to healthcare, education, and research for all people in our communities. So this grant will help ensure we continue and expand on that work. We previously supported programs that advance health equity, meaning so that everyone has a fair and just opportunity to achieve their best health, regardless of race, socioeconomic status, ethnicity, or where they live. So, for example, we backed Montefiore's program to incorporate screening patients at their doctor's offices to better understand the challenges that they face. For example, access to healthy food or transportation so they can keep their medical appointments. So what we're going to do with our grant is to launch new resources for research that advances health equity. Our institute's theme is building bridges in the Bronx and beyond. And that just emphasizes that part of our work will be developing ways to engage the community so that residents can help us think about research directions and priorities. And we also want to understand and mitigate larger issues like bias and discrimination in health systems that prevent people from getting the care they need and deserve. For example, a big project that we're sponsoring with funds from the new grant is to study and address knowledge gaps and biases and the inclusion of people with developmental disabilities in research. We really want to make sure that there's a diverse group of people in clinical trials so that the results are generalizable to the broad population. And so we'll expand our outreach in the community to make sure we're recruiting a wide range of participants.
Yeah, I know you've done work before, particularly in the area of research right here for the borough of the Bronx, dealing with some of the disparities and some of the health inequities that are going on. Can you share with us a little bit more of your background in this area? Because this isn't the first time around for you.
No, it's not. But as I mentioned before, this is work that we have been engaged in all along. But we are in particular going to develop more effort to advancing health equity. It's a very complicated issue, understanding the causal factors that result in health disparities. And so we're going to develop new methods to better disentangle what those issues are, how to address them. Another important factor in addressing health disparities is training a diverse workforce so that the health professionals better reflect the communities they serve. And we will also develop novel digital tools to facilitate the enrollment of diverse patients into our studies.
Yeah. Well, you've got people in the Bronx and you've got people in Manhattan who are watching and across the city. How could they be involved in the research or partake in this, as part of this grant?
Right. So again, our institute is supporting numerous ongoing studies in different disease areas, many of which I mentioned, diabetes, cancer, asthma, that are of greatest concern to the Bronx. But our institution also has strengths in studying other areas like aging-related health conditions, developmental disabilities, and psychiatric disorders. And so to get involved and learn more about these and other studies, I recommend that people go to our Institute for Clinical and Translational Research website. There's a lot of resources, information there about our ongoing studies, to contact our office to learn more. And we also encourage people to join the community advisory boards that Montefiore has developed to help inform our research priorities and activities, because we want to make sure that what we do in our institute is in line with the priorities and concerns of the community.
Yeah. Dr. Kim, I want to thank you so much for joining us and sharing. And as we look at this $30 million grant, before we go, talk a little bit about the duration. This is $30 million over a course of how long?
So over a course of 7 years.
Good. So, of course, we got a lot that we can look forward to for here in the Bronx as well as across Manhattan, New York City. And thank you so much for sharing with us.
Thank you so much for having me today.
All righty. Well, we want our viewers to know if you want more information, you can visit the website at einsteinmed.edu/centers/ICTR. Also, follow them on Twitter at EinsteinICTR. We encourage you to don't go anywhere. We got more open coming up right after this.